Health company Pfizer has used the World Economic Forum platform to announce an accord to improve health outcomes for more than 1 billion of the world's poor. Pfizer says it will provide all its current and future patent-protected medicines and vaccines available in the United States or EU on a not-for-profit basis to 45 lower-income countries. That includes 23 medicines to treat cancer, pneumonia, meningitis, among others, as well as a COVID-19 vaccine. Rwanda, Ghana, Malawi, Senegal and Uganda are the first 5 countries to commit to join the accord. Pfizer says the accord seeks to greatly reduce the health inequities that exist between many lower-income countries and the rest of the world. Earlier, my colleague Francis Hurd spoke to Pfizer CEO Albert Bourla from Davos in Switzerland.
It is all the low-income countries, according to the definition of the World Bank. These are 27 countries. And then to make sure, because there are some blur lines, we are including also all the countries that graduated from the low-income status the last 10 years. Those give us other 18 countries, a total of 45, most of them in Africa, and 1.2 billion of population.
Am I right to say the Pfizer COVID-19 vaccine is included?
It is included. It is included also the oral pills, the medicines that we have, but includes all the medicines that are right now under patent protection. So there are not possibility for generics in these countries, and also includes all the future products that, because we are introducing every year 1-2 new medicines, also they will be automatically included.
This is wonderful, but some will question why now, when, according to your own press release, 9 million people have already died in the countries that we're talking about from COVID-19. When you developed this vaccine, there was no help for poor countries except the likes of COVAX, no relaxation of IP, and the likes of COVAX was trying to compete with this incredible buying power of the rich developed markets. Research suggests that in the first year, vaccination rates up to 80% in high-income countries, lower than 10% in low-income countries. Many have blamed that on farmer greed. So is it not too late?
I think, first of all, it's never too late to do something good for people. And this is something good for people. The second thing is that the issue of lower vaccinations it's something that was not that much related with supply, as we all know, because right now we have available through the US government 800 million of vaccine doses of mRNA, the same doses, that are available for free completely, not even the logistics. But unfortunately, a lot of the countries, they don't have the right infrastructure or the desire from the people to get vaccinated. And this is a problem. This is why, now that we decided to give all these medicines for all the diseases at a non-for-profit price, we know that it's not enough just to give the medicine and wash our hands. That's why we selected from the 45 countries 5, but there are 5 in Africa, that we want to work with them, not only on the issue of we give you the medicines, but what does it need to happen in the country so those medicines will be used. It is one thing to have a medicine for breast cancer. Another thing is to make sure that women with breast cancer are diagnosed.
And I do want to talk about that. Malawi said this is a true partnership between the countries and Pfizer. But if you don't mind, I'd just like to talk about the COVID-19 vaccine, because you haven't been transparent about pricing at all. And a lot of money has already been made. So in South Africa, it was reported that we were paying higher prices than many first world developed countries. Why was that acceptable to you then, in the midst of a very fatal pandemic in the early phases?
The prices that we set was always from the get-go, from the beginning, prices that they follow the principle of tier price. The high-income countries, they paid one price. The middle-income countries, they paid a different price. And the low-income countries, they paid a cost. So that was the price that South Africa paid, the middle income.
This accord, you say, it involves all your drugs, so you're not making profits first and then handing it over to the low or middle to low income countries. You're now going to do everything that basically comes off your shelves or out of your research labs.
Yes, every new innovation that is coming, new medicines, for example, automatically also will be added to this list. Already we made a list of all the products that are available right now in EU or in the US, and they're patent protected. But I tell you, it's all.
All right, we were talking about the partnership. So tell me, how exactly does it work? Do you just deliver the drugs at cost to anyone who wants to buy them? Or is there any plans to help South Africa, African countries rather, not South Africa alone, but African countries that want to manufacture these drugs to get involved in the supply chain at all?
All of these drugs we will provide them at a cost, and they're produced by us in the same manufacturing sites that they're produced for the US or for Europe. So I think that will be very easy to do. What is the difference between the 45 countries and the 5? Everyone will have access, all 45, immediately. If they would like to procure those medicines and these prices, they will be free to it. It's just because we realized that a lot of the efforts to provide medicines sometimes are not enough when the realities on the ground of the country are such that there is not enough people getting diagnosed, or there's not enough nurses to administer the medicines, etc. We try to work. We selected 5. They have very high interest, those 5 countries, in health issues, and then we will work collaboratively, not only us and the governments of these countries, but hopefully other organizations like the World Health Organization or non-governmental organizations, hopefully the Gates Foundations, the Carter Foundation, everyone that has an interest and resources on the ground to make sure that we do the right thing in organizing those countries so that they can receive this medicine.
All right, so finally, what's the upshot? How many people can be saved?
I hope many. The population that we are providing right now access at the non-for-profit is 1.2 billion people. This is a lot of people. The number of products that we are providing is significant and covers significant diseases, cancer, cardiovascular, you name it. So arthritis. So we have an opportunity here to do something really great for the people. We have an opportunity to do something that can change the disease heat map of Africa in a few years. Because we know that many of the diseases that are right now present in the continent of Africa are diseases that are underdiagnosed, unfortunately, because there are not medicines. When you don't have a medicine to treat someone with prostate cancer available, it's difficult to make the diagnosis also because it's becoming meaningless. Now we will have the medicine, but we need to make sure that we will have also the diagnosis. That's why I think that the two needs to go together, and we need all of us to work together.